Good afternoon, everyone. This is Dr. Val Arkush, Chair of the Montgomery County Board of Commissioners. Today is Wednesday, March the 3rd, 2021. We are in the 52nd week of the COVID-19 pandemic here in Montgomery County. And today I'm joined by my colleague, Commissioner Ken Lawrence. I'm going to start off with an update on our vaccine operations. I'm happy to report that our 2 mass vaccination clinics remain on track and have been fully operational this week with both first and second dose clinics. Montgomery County received all necessary second doses of Moderna for this week. And I want to be clear that the Montgomery County Office of Public Health received all necessary second doses. And our first dose clinics are running smoothly. We have made the switch this week to administering the Pfizer vaccine. As I stated before, the county wants to be able to say yes to any vaccine offered to us. Consequently, the Montgomery County Office of Public Health will be bringing all people back for their second dose, regardless of which vaccine they received, using a 28-day interval, so that we don't have some individuals needing to come back in 3 weeks and some others needing to come back in 4 weeks. There is no medical reason that we cannot extend the Pfizer interval to 28 days, and doing this will maximize the county's ability to accept all vaccine offered, as well as maximize the daily doses that we give. We continue to remain flexible to provide both the Moderna and Pfizer vaccines at our clinics, and when the state is ready to provide us with Johnson & Johnson vaccine, we will be ready. We are also ready to open a 3rd mass vaccination site in the county, but the exact timing is dependent upon getting more vaccine. This site will be located near the Willow Grove Mall. We are optimistic that we will be able to open this 3rd vaccination site next week. We received welcome news today about our teachers and educational support staff and are extremely pleased that they will soon be able to get vaccinated as part of the state's allocation of the Johnson & Johnson vaccine. This is a welcome addition to the support that the Montgomery County Office of Public Health has already been providing to schools. This support includes weekly meetings with school superintendents, an assigned Office of Public Health staff person to work with each school's pandemic coordinator, immediate contact tracing of positive cases, setting up antigen testing of teachers and certain educational support staff in those schools that want it, and priority vaccination of 1A eligible educational staff. Now let's take a look at the progress that the county is making with vaccinations. So you'll see in the upper left corner, the County Office of Public Health has received 40,440 first doses, and this is as of yesterday. Also, as of yesterday, end of day, the County Office of Public Health has administered 29,684 doses. So we currently have about 11,000 doses available to us, but keep in mind we got about 5,000 of those doses yesterday afternoon. So we continue to vaccinate about 1,000 people a day with first doses. So that leaves us about another 5 to 7 days before our next shipment, and we should have 3,000 or 4,000 doses on hand when that next shipment comes. So this is a better place to be than we've been, because this actually allows us to schedule our clinics out a little more ahead of time than we've been able to do the last couple of weeks. We are booking appointments for pre-registrations on or before January 13th, and I'll talk a little bit more about that in a minute. In terms of our county-wide vaccination status, so this includes all vaccines given by any provider to a Montgomery County resident. We now have in total 84,955 people who have received 1 dose and 42,232 people who have received 2 doses. So this totals 127,187. This is 19 or nearly 19% of the eligible population in Montgomery County have now received at least one dose of vaccine. So that is great progress, not as fast as any of us want it, but it's nice to be getting close to that 20% mark. Just a reminder that only people 16 years of age and older are considered eligible. Moving on to our countywide race and ethnicity data, we're pretty much where we were a week ago when we last reported this. I just want to highlight again that we have in the data that we're reporting over 28,000 people that have not reported their race. That works out to about 24% of the people that have been vaccinated that are Montgomery County residents have not reported their race. And I just want to urge people, although I know it is a very sensitive issue and I understand the discomfort with this issue, but it is critically important that we understand the race and the ethnicity of the people that we're vaccinating. That will help us ensure that we are creating opportunities for every person in our county to be vaccinated and to do so equitably. Similarly, with ethnicity, we have over 43,000 people who have not shared their ethnicity. This works out to about 37% of the people who are Montgomery County residents that have been vaccinated. We do not have information on their ethnicity. So again, I just want to urge people to please report that information. It is critically important to us to make sure that we reach everyone in the county. So moving on to our hotline and phone pre-registration update. Last week, I announced that pre-registration for the COVID-19 is now available by phone through our COVID-19 hotline. Our Office of Senior Services has implemented this service for people in the county who need support pre-registering for vaccine appointments by phone. Since last week, we have pre-registered over 500 people by phone, most of whom were over the age of 65. To pre-register for the vaccine by phone, you can call our hotline number, which you see on the screen, 833-875-3967, and let the agent know you need support to pre-register for a vaccine appointment. Once the registrant's information is in our pre-registration system, it will be placed in line to receive an appointment. When we have vaccine for you, a volunteer will call you back and let you know what appointment slots are available, and they will be able to book that appointment for you over the phone. There is no need for callers to have a valid email address or internet access. This new service is staffed by volunteers, and I want to thank everyone who has volunteered to provide this service for our residents. To date, over 180 volunteers have been screened, background checked, and trained to support this vaccine registration effort. I just want to thank all of you so very, very much. To inquire about volunteering, please visit the Montgomery County Office of Senior Services website. That's at montcopa.org/senior services. And that's all one word, senior services. For those of you who have already pre-registered on our site, we continue to send weekly emails to keep you updated on our vaccination progress and what you can expect when it's your turn. As of this morning, we have 185,512 people pre-registered. At this time, and depending upon when you registered, it may be up to 12 weeks before you hear back from us about scheduling an appointment with our current rate of supply. We now have information on our website to give those of you who have pre-registered some idea of where you are in the line. On our vaccine page, there's now a link next to a blue flag that says Status of Vaccine Registrants. This link will take you to a chart that lists how many individuals pre-registered each day beginning January the 12th when the pre-registration site opened. If you know the date that you registered, you can see how many people are ahead of you. Currently, we are registering people for vaccine appointments who registered on or before January the 13th. Now, this particular day had 30,000 people pre-registered. The good news is that we should be contacting the last group from January 13th this week, and we will be able to move on to January 14th very soon. We are finding, not surprisingly, that some of the people that are pre-registered have received vaccine in a different location, and so they get removed from the list, and we just go on to the next person. So the line's moving happily a little bit quicker than we had thought if none of those individuals had been vaccinated. The website also displays a running total of how many doses of vaccine we have received and how many doses we have given. And that's updated every Wednesday just prior to this press briefing. So to get to this vaccine page, go to montcopa.org/COVID-19 and click on the vaccine information button at the top of the page. Last week, I shared that our County Department of Public Safety, under the direction of Dr. Al Wong, will begin taking vaccine to our most vulnerable elderly residents who would otherwise not be able to come to a mass vaccination site. As of today, our mobile vaccination program is up and running, and we will be providing vaccine to elderly individuals who live in congregate senior housing. Each week, we will set aside a portion of the vaccine received by our Office of Public Health to supply this new mobile vaccination effort. I am so pleased to see this program get off the ground, and I thank our team for getting everything in place for this important outreach effort. By establishing a mobile vaccination program, we are well positioned to reach residents with barriers to access in our communities, and we will be ready to serve more people as our vaccine supply increases. Now, an update on the governor's revised mitigation order. This past Monday, Governor Wolf revised the mitigation order on gatherings and lifted the out-of-state travel restrictions. Because of this, I would like to take a few moments to review the updated guidance and what is required to hold approved events in Montgomery County. As a reminder, these event requirements are in place to ensure that large gatherings, whether it is for sports, entertainment, or any similar events, are done in a way that will protect the health and safety of those in attendance, those who are working at the event, and the general public. Under the governor's revised capacity limits, indoor events and gatherings are limited to 15% of maximum occupancy. Outdoor events and gatherings are limited to 20% of maximum occupancy, and the county is following those capacity limits. However, I just want to remind you that under the existing Montgomery County Office of Public Health mass gathering order, mass gatherings are defined as more than 25 people gathering in an indoor venue or more than 250 people gathering at an outdoor or temporary structure setting. Any event that qualifies as a mass gathering under the Office of Public Health's order is required to apply for a permit from the County Office of Public Health. I just want to be clear, we're following the governor's capacity limits, but we want to work with anyone organizing an event or gathering that is planning to have more than 25 people indoors or 250 people outdoors to submit a COVID-19 mitigation plan to our Office of Public Health so that we can work together to make these events as safe as possible. The COVID-19 mitigation plan must be submitted to the Office of Public Health at least 15 days before an event is advertised. Information on these requirements and the form can be found on our website at www.montcopa.org/COVID-19 guidance. And you can see that URL on the screen in front of you, montcopa.org/COVID-19 guidance. And again, we just want to urge any facility considering an event or gathering to please reach out to our Office of Public Health. Even if your gathering is within the allowed number of attendees for the space, we'd love to have the opportunity to review your plans. We've learned a lot over this last year about how to keep these events safe, and we want to share that with you and help you have the safest and best event possible. Now, moving on to our regular update. Since the February 24th press briefing, we have 898 new cases of COVID-19 reported in Montgomery County for the dates inclusive of Wednesday, February the 24th through Tuesday, March the 2nd. This is a daily average of 128.3 cases per day, a daily average, and brings us to a total of 47,091. Now, for those of you paying close attention, these numbers are higher than the numbers that we reported last week. We actually saw an increase in cases this past week compared to the week prior. In looking carefully at the data that we've received over this week, there were a little over 100 tests that were 10 or more days old. 7 or more days old. So this isn't necessarily an increase in cases, at least from a time perspective, but I have seen that some of our neighboring counties are seeing a similar plateauing of the numbers rather than the steady decrease in the numbers that we had been seeing for several weeks. So again, this is just a reminder that we are not out of the woods yet by any stretch of the imagination, and that it is critically important that we continue to observe all the mitigation measures. In terms of the tests that we're reporting today, 6 of them are from long-term care facilities, 3 are from the Montgomery County Correctional Facility, 5 are from other congregate settings, and 884 are from the community. These positive individuals are from 59 municipalities. As you know, all 62 Montgomery County municipalities are home to individuals with COVID-19. Today's individuals range in age from 7 months old to 96 years old, and you can check our county maps at montcopa.org/COVID-19 for updated geographic information. Today, we have 444 females and 453 males and 1 unknown. I am very sorry to confirm that 31 additional Montgomery County residents have lost their life to COVID-19 during this last week, bringing us to a total of 1,231 deaths confirmed positive from COVID-19. These 31 individuals ranged in age from 41 years old to 100 years old. 22 died in a hospital, 3 in a long-term care facility, and 6 in a private residence. Overall, 626 females and 605 males have lost their lives to COVID-19. They have ranged in age from 25 years old to 106 years old. In terms of the racial breakdown, 2 identified as American Indian or Alaska Native, 34 as Asian, 7 as Asian Indian, 5 as Asian Korean, 144 African American or Black, 640 white, and 399 unknown. At the Montgomery County Correctional Facility, the situation remains stable. All inmates at the correctional facility that have tested positive for COVID-19 are in isolation and stable without symptoms. We continue to do routine antigen testing on all correctional officers. Moving on to our positivity rate. Our positivity rate has continued a downward trend this week. Our 14-day average positivity rate is now 5.47%. as of Thursday, February the 25th, compared with 6.12% as of Thursday, February the 18th. So this is all great news. You can see our 14-day PCR positivity rate on the screen. As a reminder, the orange squiggly line is the number of daily PCR tests conducted, and the blue line is the 14-day average PCR positivity rate. As a reminder, a positivity rate below 5% is considered suppression of the virus. This graph shows the daily positivity rates for January the 29th through February the 25th. And similarly, you can see this downward trend. The county fell below 5% on 6 of these days in the last 2 weeks, which is great progress. Prior to this, the last date we were below 5% was November the 4th. So again, keep up the good work. We are not out of these woods yet, but we are clearly moving in the right direction. Our hospitalizations continue to remain high, but have improved since last Wednesday. Today, 121 individuals with COVID-19 are hospitalized in a Montgomery County hospital. This is decreased from 154 last week. 17% or 21 of these individuals are requiring a ventilator. Our hospitals do remain busy. To put this in some context, on October the 1st, there were only 24 patients hospitalized with COVID-19 in a Montgomery County hospital. So again, moving in the right direction, but we still have a ways to go before we're down into that phase where we can feel like we've solidly suppressed this virus, as we did over, from June right up until just before Halloween. In terms of testing, for the 14-day period ending February the 25th, sorry, I've got my dates wrong here, ending the 25th, 35,718 Montgomery County residents were tested, which is an increase of 1,344 people tested compared with the 14-day period ending February 18th. So interesting, we had been seeing a decline in testing over several weeks. We saw an uptick this past week. So usually that means there's a few more people out there having symptoms consistent with COVID-19. So again, just a reminder, we need to be careful. Let's take a look at our date tested graph next. So as a reminder, the gray bars are the number of positive cases on any given day. The red is the 7-day average of total cases, including community and long-term care facility and other congregate settings. The pink is the 14-day average of total cases. The dark blue is the 7-day average of community-only cases, and the light blue is the 14-day average of community-only cases. And down at the bottom, the orange and the yellow lines are the 7 and 14-day averages from long-term care facilities. Next, we'll zoom in on just the last couple of months. And you probably all know this by heart at this point. Thankfully, we're seeing just a slow, steady decline since the holidays. And both the 7 and 14-day averages are moving downwards, but you can see there at the very far right side, just this little bit of an uptick in these last several days. So just be mindful of that. Hopefully this is like walking down a staircase where you have some flat risers along the way, and hopefully we will continue this overall downward trend. It's the first Wednesday of the month, so it's time for our age cohort chart. Just to orient you to this chart, the far left column shows the age cohorts as defined by the census, followed by the percent of our population that particular age cohort represents. The next columns, beginning with April 1st, show the percent of cases within each of those cohorts and whether they've been increasing, which is red, or decreasing, which is green, compared with the prior month. You can see over time that the oldest individuals continue to be a smaller share of our cases and younger people a higher share. I want to note that we are seeing a small uptick in the 15 to 19-year-old cohort for 2 months in a row now. This age group is also slightly overrepresented in the number of cases compared with their percentage of the population. In other words, 15 to 19-year-olds are 6.16% of our population, but they represent 7.23% of the cases. There is a continued decrease in the cohorts that include 20 to 44-year-olds, which is good news, but I also want to point out that these 3 cohorts also remain overrepresented relative to their share of the population. So please get tested. We continue to have plenty of testing available. And I want to urge anyone who wants or needs to be tested to get tested. As a reminder, this is no barrier testing. There is no cost. You do not need a doctor's order. You do not need to have symptoms. You do not need to have a car. You can be of any age. All you need is an appointment. And to make an appointment, you can do that online or by phone. To register online, you can go to www.montcopa.org/COVID-19. Click under the green County Testing Information button. Appointments open at 7 a.m. on the day that you want to be tested. You cannot book ahead. Phone registrations available for all 6 of our sites at 610-970-2937. That opens up at 8:30 in the morning of the day that you'd like to be tested. And there is language line available by phone. So that is it for today in terms of our regular update. Just, remember, there's still virus out there, and please continue to be careful. We have heard about other states lifting their mask wearing orders and other mitigation orders. We have not done that here in Pennsylvania, nor should we. We are not in a place where it is time to start lifting those mitigation steps. It remains critically important that you wear a mask whenever you're outside of your own home and around people who are not part of your household, that you keep that 6 feet of social distancing, and that you wash your hands. We are not out of this yet. So in terms of announcements for today, we continue to host virtual COVID-19 town halls to answer your questions and concerns about the vaccine. The next town hall will be tonight, Wednesday, March the 3rd at 7 p.m. For this town hall, we're teaming up with the Bucksmont Collaborative, the Tri-County Community Network, Interagency Council of Norristown, and the Montgomery County Immunization Coalition. To register, you can go to montcopa.org/town hall. Next week, we're teaming up with AARP to host a telephone town hall for their members and any seniors who want to tune in. You do not have to be an AARP member to participate in this town hall. The town hall will be held at 11 a.m. on Monday, March 8th. To join the conversation, you can call 855-286-0295. And again, I just want to emphasize that this is a telephone town hall. No internet or laptop or any kind of device required for this one, just a telephone. And finally, on March the 16th, we're partnering with the Asian American Coalition for a virtual COVID-19 vaccine town hall. This town hall will be held at 7 p.m. and registration is available at montcopa.org/register. And as a reminder, there's no cost to attend any of these events. Registration is open to anyone for any of these events. And this is a great opportunity to get factual information about the vaccine, get questions answered that you might have. In all of these cases, either on the phone or by internet, we do take questions in the chat or through the phone. So you can almost always get your questions answered. And with that, I will just remind you that our next virtual meeting will be next Wednesday, March the 10th at 1:30, and happy to take any questions.
Just as a brief reminder for our reporters, we have a 3-question per reporter limit today. We'll start with Chris Shoemaker from the Intelligencer.
Good afternoon. 2 questions for you. You mentioned the Willow Grove site hopefully opening next week. How many people do you expect to be able to vaccinate there, and how much do you need your supply to increase before you open it?
So I want to be really clear that it's a delivery of vaccine issue. That's one thing compared to the capacity issue. So the capacity of this site is large. We believe that we will be able to give between 4,000 and 5,000 first doses. And then when the time comes in the same location, we will be able to give the same number of second doses. So at its full capacity, it should be able to do a total of close to 10,000 people a day. That would be half first doses and half second doses. If we are able to open up next week, it will be with much, much, much less than that. Probably if we get enough vaccine, we might be able to do something along the lines of 500 people a day. We'll see, maybe we'll be pleasantly surprised and we'll get more vaccine next week. But we are building it for that level of capacity, the 4,000 to 5,000 a day of first doses and 4,000 to 5,000 a day of second doses, knowing that more vaccine is coming. And we want to be able to say yes to every dose offered to us, and we will be ready for it when it comes.
Okay, thank you. And regarding the plans that have been publicized about a possible third-party vaccine site at King of Prussia Mall, have the operators been in touch with the county, and are you supportive of those efforts?
The operators have not been in touch with the county as far as I am aware. And it is my understanding from the Pennsylvania Department of Health that they have not been promised any vaccine. So that's all I know about it.
That's it for me. Thank you very much.
Next, we'll go to Jim Melward from KYW.
31 deaths, is that high, and is that all from 1 week, or is it the way it's reported?
Yeah, that is high. And most of them were in that last week. I do believe we can get you a firm number on that. I think there were some from earlier, but I don't have that right in front of me. But that is an increase in number. As we've talked about through this entire pandemic, sadly, deaths do lag cases. Oftentimes it's, weeks to a month or even longer before someone passes away from COVID-19. So it's not unusual to see an increase like this, given the numbers of cases that we were seeing a few weeks ago. But it is a reminder of how serious this situation remains.
I apologize if you covered this. I was a little distracted when you were talking about the gathering permits. Are they required? And if so, what happens if someone does not get a permit, especially for a private event?
So the Office of Public Health permits are required for gatherings that involve the public. However, we really urge all event venues to reach out to us and talk through a plan with us. We have found these conversations to be very helpful. They are collaborative. Again, our goal is to help these venues and other event operators have the safest possible event. These events are the most successful when people feel safe attending them. So we are looking to work collaboratively with our hospitality industry and others who want to hold these events. So please reach out. We are really here to help, and we have learned so much in the last year about how to make these events safe.
And I hope I'm not stepping on Carl's toes here, but Pottstown's about 45 minutes from the community college. Willow Grove's about 25 minutes. Is there, in geographic fairness, I guess, is there any consideration on the county's part to do something in the western part of the county?
Absolutely, and those plans are in the works.
Any like a timeline or any guess on that, or any location or any more detail on that?
As soon as I have details, I'll share them with you.
Thanks.
Our next reporter will be Deanna Durante from NBC 10.
Sorry, too many windows open. I lost you all. Okay, so 3 questions. One, I know we touched on the site at the King of Prussia Mall. Who would have to report, or who would have to regulate that? And what do you say to people who see these pop-up sites, whether they're private testing sites in parking lots or a site promising vaccinations? Would that count under your county's permitted gathering? And would you have any, I guess, leeway or overseeing of these things to make sure that they're done safely? And when it comes to vaccinating teachers, would that change any mitigation steps inside schools, spacing, masking, things like that, or would it still be the absolute same that schools need to follow?
So going back to your first question, Deanna, were you referring to this vaccination site in King of Prussia? Is that?
Yes, but I mean, we're seeing more and more, obviously we're seeing plans of that, but you see more and more in parking lots too of testing and drive-up testing and private companies that are offering all of these services that aren't necessarily the county. And people want to get tested, people want to get a vaccination. So A, how can they be sure that this is a legit place? And B, when you see these private places opening up shop for things like vaccinations, who's making sure that this would be a safe place for them?
Well, I want the public to understand that none of those places are under the county's jurisdiction, none of them. And we don't provide vaccine or testing supplies to any of those locations. The Pennsylvania Department of Health is who provides vaccine to any of these locations, or possibly, depending upon which pharmacy it is, they could be part of one of the federal retail pharmacy programs. But the county has no oversight over any of those. So I just urge people to do their due diligence and find out, who the vendor is that is offering these things. And you could certainly check with the Pennsylvania Department of Health to see if they've had any issues or complaints with them, but they are the oversight on those types of facilities.
Then when it comes with teacher vaccinations, would that change the way the county and the state, or at least let's just go to the county since that's what we're talking to, how you are guiding schools on how to go forward with whether they're reopening to hybrid or fully in-person learning when it comes to spacing and masks and those things? Would there be any changes in the mitigation protocols that schools need to follow?
We will do what we've been doing since the beginning of the pandemic, which is following the guidance of the Pennsylvania Department of Health and the Pennsylvania Department of Education. So if those entities decide to change the guidance, then we will change with them. I'm not aware of any plans to change that guidance, but certainly if they do, then we will do the same.
And then just to be clear on something that you mentioned in the beginning, you are caught up on the Moderna shortage issue, or you will be. You've got the doses that you need to make up for those missed or canceled appointments.
So happily, the county health department has received all of our second doses of Moderna. We are aware that not all facilities in the county have, but we here at the county have received all second doses that we were due. So we have not had to cancel any second dose appointments except for weather. And there were some delivery problems when we had those couple of bad wintry days, but we have received all of our doses. If there are people, and I know there are people out there who are owed a second dose by another facility, they need to call that facility and insist that they be vaccinated. The vast majority of these, well, really all of these facilities should have received second doses. And if they use them for first doses, then that is on that facility. But it is the responsibility of those facilities to vaccinate those individuals. If they tell those individuals that they do not have vaccine, those complaints should be reported to the Pennsylvania Department of Health. Again, we are not part of that. We don't have oversight of it, and we don't have vaccine for those places. So those complaints need to go to the Pennsylvania Department of Health.
And that's my 3 questions. Thank you.
Next, we'll go to Carl Hessler from the Pottstown Mercury.
Hi, Commissioner. First question, how does the addition of the J&J vaccine and the government's announcement regarding teachers getting the vaccine change your outlook for the coming months? Does it change your outlook for the coming months in any way?
Well, it's certainly good news for our schools. And the way this program will run is that it will be set up at the Montgomery County Intermediate Unit for Montgomery County Schools. And the National Guard, as well as, the Pennsylvania National Guard, as well as a staffing agency, will be providing the individuals to actually run the site. And then, of course, they will receive the Johnson & Johnson vaccine. So it's just terrific news for our schools. We all know how challenging the school situation has been. So in terms of our overall outlook, we still hope that we will get more vaccines soon, so that we can get these additional mass vaccination sites open. People are just clamoring to be vaccinated, and we want to vaccinate them. We're ready. We just need more vaccines. So we are very much hoping that we are going to hear soon that we will be receiving more vaccine here to the county for our mass vaccination sites. Just one other point about Johnson & Johnson, because it is a single dose, I have already asked the state if they would consider carving out some number of doses that could be used for very special populations like our homebound individuals. You know, we do have a number of individuals in the county that are truly homebound. There is really no way for them to get to one of these mass vaccination sites. And it would be just so much more efficient if we could take a single dose of vaccine to their home rather than have to make 2 trips. So I'm hopeful that there might be, you know, some doses available to us for that purpose.
Okay, question 2. I think it was 4 federal lawmakers from the region this week called on the governor's office to improve the vaccine plan. What do you feel needs to be done to perhaps ease the frustration that citizens and community leaders are feeling? And what do you say to people who want the vaccine but can't get an appointment?
Yeah. Well, I'm hoping for increased transparency from the Pennsylvania Department of Health. I think, I don't want to speak for my colleagues, but I think it's probably fair to say that none of us understand what the allocation algorithm is for the southeastern Pennsylvania counties. So I'm looking for more transparency. I am looking to understand how these allocation decisions are being made. And I'm hoping that once that information is given to us and we understand it, we will be able to better advocate for more doses here to our region. You know, Southeast Pennsylvania provides a very substantial contribution to this state's revenue and tax base, a bigger contribution than our proportion of the population. And everybody who lives here knows that people travel between our counties for work, for recreation, and all sorts of activities, and that we need to get the Southeast back as an entity, as a whole region, in order to get our economic engine back on track here for the entire Commonwealth. So I do not understand why we are not getting more doses. You have heard me say this every week since we started getting vaccine, that we are ready to give more. We should be getting more. And I hope very soon that we will be getting more.
So it is your opinion that while Southeast PA was a hot spot as the virus spread and actually was the last region to emerge from the governor's shutdown, you do believe that there's less vaccine coming to the region, even though this region was really hit really harder than some other regions?
From the data that I have seen so far, yes, I would agree with that statement.
Okay, that's my 3 questions. Thank you.
Carl.
Next, we'll go to our communications director, Kelly Francisco, with a few questions from Charlie Rextis from the Delaware Valley Journal.
Thanks, Todd. The first question is, with the new guidelines for teachers being eligible for the Johnson & Johnson vaccine, will this conflict with getting the group of 65 and older vaccinated?
No, it shouldn't conflict at all. In fact, the good news about this is additional doses of vaccine into our county. So the county has already been vaccinating teachers and educational support personnel that were in the 1A category because of their age or because of an underlying condition. And these additional J&J doses, which will be administered in a separate location from the county's mass vaccination sites, will broaden the teachers that are eligible for vaccination and bring additional doses into the county. So it's good news all around.
Thanks. And the second question is, what are your thoughts on the governor's announcement about teachers being prioritized for the J&J vaccine?
I think that's appropriate. For those of you that are weekly viewers of this briefing, I was very unhappy when the teachers and other workers in the 1B category got pushed so far behind so many others when the eligibility criteria were changed. And the teachers in particular are so critical for so many parents to be able to get back to work, and they need to be able to get their kids back in school. So it's important for our parents, and most importantly, it's important for the kids. Some kids are doing okay with remote learning, but many others are not, and particularly the youngest students. So it is so exciting to hope that they will be able to soon get, most, if not all, of our youngest students back into classrooms and do it in a way that's safe, and the teachers and the support staff are safe, and we can kind of get back to something a little closer to normal. So I couldn't be happier about this.
That concludes our questions for today.
All right, thanks everybody. We'll see you next week.